skup i da vam zaželim da se osjećate prijatno, mada baš nisam siguran koliko će da bude prijatno, obzirom da smo se dogovorili da nas bude 30, a ima nas 50. Ali, Bože moj, kuća nikad nije tesna, tako. Veterinarski institut u Jagodini je osnovan 1952. godine, funkcioniše na teritoriji Pomoravskog i Šumadijskog upravnog okruga i to je teritorija na kojoj je živinarska proizvodnja ubedljivo najrazvijenija grana stočarstva. Ovde se godišnje eksploatiše oko 120.000 roditeljskih parova, oko 1 milion koka nosilja konzumnih jaja, godišnje su tovi oko 5 miliona piladi i oko 100.000 ćuraka. U inkubatorskim stanicama proizvede se oko 15 miliona jednodnevnih piladi i imamo 5 klanica isključivo za živinu. Ovakav obim proizvodnje od veterinarske službe zahteva visoki kvantum znanja i visok nivo organizovanosti, kako veterinarska služba treba da da svoj doprinos da ne bi bilo gubitak u živinarskoj proizvodnji i da se na tržištu pojavljaju isključivo namirnice koje su kvalitetne i zdravstveno ispravne. Mi nismo do sada imali zdravstvenih problema kod ljudi kao posljedica konzumiranja neispravnih namirnica poreklom živinarske proizvodnje i takav trend treba i da se zadrži. Zbog toga ja mislim da će ovakav skup da bude od velike koristi da razmenimo iskustvo sa našim kolegama iz inostranstva i da unapredimo svoje znanje. Dozvolite mi samo par reči na engleskom od kolega iz inostranstva. Ladies and gentlemen, respect colleagues, welcome to Veterinary Institute in Jagodina and to our beautiful city in the center of Serbia. My name is Zoran Rašić, I am director of this institute, and I am very pleased that the organizer decided to hold this workshop here. Veterinary Institute in Jagodina was founded in 1952 and covers territory about 5,000 km per square, and poultry industry is very development branch of livestock breeding. I hope and I believe that workshop will be very useful for all of us. Thank you very much and have a nice day.
Yes.
Uživajte i...
Dear colleagues, in behalf of organizer and the Faculty of Veterinary Medicine, please be welcome here Veterinary Institute in Jagodina and Poultry Workshop. I just want to briefly introduce Professor Corrie Brown from the University of Georgia. She's a pathologist for all species, but today she will talk about poultry pathology.
Okay. Ivana, thank you very much. I'm very happy to be here. I've been in Serbia several times, also Montenegro, other places, Kosovo. I'm happy to be here in Jagodina. Ja sam srećnja. This is a new effort on behalf of the Davis-Thompson Foundation to actually go out beyond the capital cities and do a workshop, which means you are expected to work. My colleague Tanya and I have founded the Global Health Pathology Network, which is part of the Davis-Thompson Foundation. And we're going to start with Jagodina, and I think that's a great place to start. You may know that Sam Thompson died, a year or two ago. He was 90 years old, and his widow is Vladislava Rak. Yes. And when we said we want to launch our Global Health Pathology Network, she pulled out her checkbook and said, "Start with Serbia." Yeah, hooray! We have a different way of doing training, and some of you may be expecting to sit there and hear us talk, and you're going to take notes. but that's not how a workshop works. So workshops function on adult learning. We know that adults learn in a different way from children. So if there's anyone in here under the age of 18, please raise your hand. We know that adults learn best by solving problems, doing case-based work. We know that they bring a rich experience into the room and that when they share it, everyone learns more. We know that they learn through social interactions. So we're going to maximize those during this workshop. Research has been done on learning, and we know that when someone walks out of a lecture that's 50 minutes long, they remember 5%. Is that how you learned when you were at the university? 50-minute lectures. And you learned well, didn't you? Look, you're all successful in your careers. That's because when you went home at night, you studied the material. This is continuing education, a workshop. There's no exam. I'm pretty sure you're not going to study tonight. And I think there's a party, isn't there? Yeah, and we're adult learners, so we're going to be social. And this is because we know that when you are listening to a PowerPoint, hearing someone lecture, you put things in your brain in short-term memory. About 7 chunks of information that come in over 12 to 15 minutes. If you don't get a chance to practice that, it gets wiped out of short-term memory for the next chunks that come in. So in fact, a 50-minute lecture is really inefficient for learning. So we're going to do a lot of case-based learning and a lot of interaction. I know that there is a tremendous amount of experience in here. I think a lot of you know each other already. Tanya and I are at a disadvantage because we don't know you yet. So can I ask you to tie your name tags so they're up a little bit higher so I can call you by your name? And I don't really like looking at your crotch. So you put it up higher so I tie a knot in mine. Thank you. Up higher so we, yeah, look at you. And we're going to start by going around the room, and you're going to tell us where you're from and what you do, just in a very brief way. And we're going to start with, is it Turpa?
Yes.
Turpa! All right. Tell us where you're from and what you do.
I'm from Macedonia.
Can you all hear him?
I'm from Macedonia, from Skopje. I'm coming from the Faculty of Veterinary Medicine, Department of Pathology.
Okay.
My name is Ines.
Ines!
I'm coming from Slovenia and I'm a pathologist, regional in Celje region.
Polona.
Polona, yeah, we met before. That's why she knows my name. I'm from Ljubljana, from Slovenia. I work at veterinary faculty. I'm a pathologist and I also teach pathology.
Igor.
Yeah, I'm a host here. I'm working in veterinary institute Jagodina, and I'm a pathologist also.
Nikola.
Nikola, I'm also a pathologist. I work in Veterinary Institute Kraljevo.
Kraljevo?
Kraljevo.
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 Huh?
They're joking. It's Kingstown.
Translate King City.
Okay.
Translate.
We'll call you King Nikola. Yes.
My name is Alexander Tomic.
Veterinary Institute Kraljevo.
Same place.
I'm also from Kraljevo. I'm Zoran Develjak. I work as a lab epidemiologist, epidemiology in institute.
Yes.
I'm Ben Krunic. I'm professor at the Faculty of Veterinary Medicine in Belgrade. I'm a microbiologist.
I'm Radula Resanovic. I'm also professor of Poultry Diseases at the Faculty of Veterinary Medicine in Belgrade.
My name is Dragan Tončić.
Radi?
Dragan Tončić.
Dragan Tonic? First name is? Dragan. 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 Like a dragon? Niche. Okay. And Igor next to you.
Hi, I'm Slavica, student from Faculty of Veterinary Medicine in Belgrade.
My name is Darko Bošnjak. I'm from Zrenjanin Veterinary Institute, I'm pathologist.
Darko?
Bošnjak.
Bošnjak.
Yes.
Okay.
I'm Danka, Veterinary Institute in Belgrade, Jagodina.
Poultry.
I'm Dušanka Čobanović from Poultry Journal, Živinarstvo in Belgrade.
Živinarstvo.
No, I am Liliana Spavković from Veterinary Institute in Belgrade, Department of Poultry Diseases.
Hello, I'm Branislav Kurezušić. I'm coming from Belgrade Institute of Veterinary Medicine, veterinary pathologist.
Hello, my name is Siniša Milić. I'm coming from Veterinary Institute of Sombor and I'm working there as a veterinary pathologist.
Hello, my name is Miro Lukaki. I work here from Veterinary Institute Jagodina. I am epidemiologist.
I'm Ilya Ivanovic. I work at the Veterinary Institute in Kyiv and the second year of PhD studies in veterinary faculty of veterinary medicine.
My name is Peter Dobra. I came from the University of Veterinary Medicine in Budapest and I work as a veterinary pathologist.
Hi, my name is Mikhaila Nikolane. I'm from Romania and I'm a lecturer and I teach infectious diseases.
Hi, I'm Simona from Turin. I'm working in Instituto Profilattico in Turin, veterinary lab, and I'm a pathologist and microbiologist.
Turin?
Turin.
Italy. Okay.
Hi, I'm Katie. I'm in the second year of a pathology resident at Nottingham Vet School in England.
Hi, I'm Vic. I'm also from England. I'm a veterinary pathologist working with pathologists to diagnostic veterinary laboratory.
Okay, let's stay on the outside of the room here.
Hi, my name is Romina Sava Ivocevic. I'm from Subotica, from the Veterinary Institute, and I am a pathologist.
Where is that? In this
Serbia.
Serbia.
Near Hungarian border.
Slovodac?
Subotica.
Subotica.
Little Saturday.
Hello, my name is Bojan Ristić. I'm coming from Veterinary Institute from Zajac.
Zaječar.
Hello, my name is Elaud Dugal. I'm coming from Bucharest, Romania, and I'm a PhD student in the Faculty of Veterinary Medicine. We've met before in Berlin.
Yes! Last month or last summer?
Last summer.
Okay! Yes, I remember. Okay.
Hello, my name is Julia. I'm also from Bucharest, Romania, and I'm a PhD student in the faculty there.
Hello, my name is Vladica Adamov. I'm a microbiologist from Veterinary Institute of Zrenjanin.
Hello, my name is Slobodan Vujinović. I'm from Veterinary Institute Šabac, from Šabac. I'm a physiologist.
Okay.
So, my name is Biljana Đurđević. I work at the Scientific Veterinary Institute Novi Sad. I'm from Novi Sad, yes.
There's a vet school at Novi Sad, right?
Hello, my name is Slobodan Knežević.
I'm working at Scientific Veterinary Institute of Novi Sad at the Department of Epizootiology.
My name is Ivana. I come from Department of Veterinary Medicine in Novi Sad. I'm assistant professor of diseases.
Okay, this is the Novi Sad group.
Yes.
My name is Marko Pajić. I'm working at Scientific Veterinary Novi Sad,
Novi Sad.
Department of Poultry Diseases.
Okay. Yeah, we're gonna. Okay, Ivana, I know you.
Yeah,
Everybody knows you, right?
Yeah.
Okay.
Yeah. I'm working at the Faculty of Veterinary Medicine, Belgrade, Department of Pathology.
Dejan Bosanac, Aviogen Technical Service Manager for Central Europe and East.
Wow. For what company?
Aviogen.
Aviogen.
Yes.
Okay. So you know you'd be able to help us when we get to all the tough
No,
buttons.
I'm Technical Service Manager, not the vet.
It's going to help you this year.
Okay, you're in charge of the projector.
Hello, I'm Milica, and I'm only poultry vet here practitioner. So
thank you.
Industry.
Hello, I'm Vladimir from Serbia. I work in Marlo Pharma, which is the animal health distributor in Serbia as technical support.
Good.
I'm PhD in
Okay. Okay.
Hello, my name is Pavel Gavrilovic. I work in Veterinary Specialized Institute Pančevo as a veterinary pathologist.
I didn't catch where it is.
Pančevo is down near Belgrade.
It's near. Okay.
15 kilometers.
Okay. Thank you.
Hi, I'm Miloš. I'm coming from Faculty of Veterinary Medicine, Department of Poultry Diseases. I'm Professor Esanovic assistant.
My name is Milan Mišenović, and I'm a graduate student at Faculty of Medicine
In Belgrade. All right. Well, we have a lot of people, and I understand that Serbian is maybe not the common language for the whole room. Yes, we prepared all of our case scenarios in Serbian, so this is going to facilitate conversations. Yes. Tanya, you want to introduce yourself?
Yes, sir. I'm Tanya Zabka. I live in California and I work at Genentech, but previously was a wildlife pathologist. And so I work with Corrie on the Global Health Pathology Network and have done a lot of international work as well. Nice to meet everyone.
Can you pull the flip chart out? Sure. So let's talk now about what are your expectations for this workshop. We'd like to get that out up front because if someone says, well, I want to know how to run an ELISA for whatever, Gumboro, although there's no ELISA for Gumboro, right? Because that destroys the bursa. Anyway, we want to get it out up front what you expect of this workshop so that we can try and meet your expectations, and if there are things that we absolutely don't have the ability to cover or time to cover, we want to clear that up too. Oh, we have flip charts but no blank paper. It's okay, we'll turn it around.
Just a moment.
We can.
We will bring one.
Is there a...
I was going to flip it over.
A whiteboard.
Yeah, or I can just do this.
All right, so while we're waiting for the flip chart, talk to the person next to you about what you expect to get out of this workshop. When you go home, what new knowledge do you expect to have? What's your name? Dusha? What's your name? Standing up in the back. Yes.
Miru.
Mirulu.
Yeah.
Miru. Okay. Yes. So you were talking to Celia and Ilya, I think, right? And what are your expectations?
For me?
We were supposed to talk to your neighbor and come up with an expectation. Now, we also know from adult learning when you give adults instructions verbally, you have to do it 3 times. So we just demonstrated that, didn't we? All right. Okay, what are your expectations of this workshop?
Ja očekujem poboljšanje znanja iz oblasti patologije, mada sam ja primarno epidemiolog.
I'm not sure I understood that.
You didn't?
No. Oh, okay. You're expecting a workshop in Serbian. All right. Does someone want to translate that, or should we move to another group? Yes.
Yes, we're expecting to learn something new in the field of poultry diseases and especially in the field of pathology.
Okay, new knowledge on poultry pathology. Okay, I think we can handle that. Yes, especially with all the expertise in the room. All right, how about over here?
Ja se sasvim da se... I agree with
You agree with him? Okay. Any other expectations? It looks like we got it covered, Tanya.
Thank you.
Other, yes.
I would like a refresher because I haven't done poultry pathology.
Refresher on poultry pathology. All right. Good. Poultry pathology and a refresher. Anything else?
Different perspectives, because there are so many different profiles of work of specialists, so they can add to a certain problem.
I agree. I think this is going to be a great forum to get a lot of perspectives and have wonderful discussions. If I can put words in your mouth?
Yeah.
Okay. Anything else? All right. Now we'll move on to the next topic. It looks like we're going to be able to meet all of those expectations. We don't have anybody we need to disappoint right up front. What are the diseases you would like to cover? What disease problems do we need to discuss? Diseases? I'm going to make a list of diseases. If there's no diseases listed, we can all get on the bus and go back home. Infectious bronchitis? You're the one who's doing a PhD in infectious bronchitis. This is good, really good. Gumboro. Okay. Gumboro, infectious bursal disease.
Marek's disease.
Marek's.
Yeah.
Thank you, Polona.
Avian influenza.
Highly pathogenic avian influenza. Oh my goodness. Yes. I have worked a lot on that. And what's the other transboundary animal disease we need to cover? The 2 big diseases that will stop trade. High path AI and Newcastle disease. Good. Let's do those. Because if you miss those in the necropsy room, you become famous, or maybe infamous. I was in Ethiopia last week, and we were doing a workshop for master's students, and we bought some chickens and necropsied them, and there was Newcastle. I've seen Newcastle almost in every country I've been in where we do poultry necropsies. Yes?
Necrotic enteritis.
Necrotic enteritis. Anything else?
Someone else.
Oh, which one? Like fall typhoid and Blorm disease? Okay, Blorm disease. Yeah. That one will really hurt the bottom line.
Gizzard erosion.
I'm sorry?
Gizzard erosion.
Gizzard erosions?
Gizzard
erosions. Now, I don't know about gizzard erosions, so put that down as a topic for general discussion. What is it? Coccidiosis.
Coccidiosis.
How about all the respiratory diseases? I'm not hearing them. Do you know about respiratory disease problems here?
Yeah, we
Most
have.
countries, that's most of the submissions.
Mycoplasmosis.
Mycoplasma? Yes. Oh, we got infectious bronchitis. What's the other really bad virus of the respiratory tract?
Laryngotracheitis.
Tracheitis, ILT. Yeah. Okay, so I think we have materials on most of these, and for those we don't cover, we're going to figure out a way to get a group discussion going to be able to cover those. We also have several others besides prepared materials. Now when I say prepared materials, what I mean are these. So we have found that this is a really effective way to present about diseases when you're in a country where there are multiple languages, is to put you into a group and do case-based discussions complete with questions at the end. So everyone contributes their expertise in a way where everyone is most comfortable. It's social learning. You learn from each other, you teach each other. We're going to start with respiratory diseases. Because in fact, in most diagnostic labs around the world, 70% of the submissions involve respiratory diseases. Is that the case in your countries? Yes? Okay. Good. This room is just a little tight for group work. We're going to count off, so you're going to go into a random group, and then we have 6 cases here. So we will have 6 groups, so there'll be about 7 people in each group, and you'll gather around and talk to each other about the case and try and answer all of the questions. When you have finished with all 6 cases, then we will review them using a PowerPoint. But as you are reviewing the cases, we want to target those people who are real experts, who are totally focused on this disease, to help contribute to the general discussion. All right, I know I didn't say that 3 times, but I'll tell you what we're going to do now. Now, we are going to count to
7.
But I only have 6 cases.
You want 7 groups?
You said 7.
If I have 7 groups and we only have 6 cases, I've got to make 6 groups. Yeah. Yeah. You know, I'm pretty smart, but math, it's really hard for me. Okay. So we're gonna count to 6? Mm-hmm. All right. So we're gonna count to 6 out loud, and you're going to remember your number. We're going to count to 6 in Serbian. Should we teach them people who don't know Serbian, how to count to 6?
Yeah.
What's your name? Marko. Okay. Number 1 is
Jedan.
Jaden. 2 is
2.
3.
3.
4.
4.
5.
5.
6.
6.
Okay. Got that? 1, 2, 3, 4, 5, 6.
You have it written down.
Yeah. All right, so we're going to count to 6 and then remember your number. Marko, you are?
1.
2.
3.
4.
5. 6.
7.
Hey.
3.
Okay, and then, I forgot, yeah. Are we at Jadan again?
Yeah.
Okay.
5. 6. 1. 2. 3.
4.
5. 6.
1.
2, 3, 4,
6.
2. Ivane, ti. Ne, trpe.
3.
You're 3?
3, ti si 4.
You're 3.
5.
1. 2. 3.
Okay. All the Yadin, stand up. Margaret, you want to take your group outside? Yeah. Get everything? 1, 2, 3. Yes. Marco's taking his group outside.
2. Ajde, prođi da.
Bojana.
Hvala. Šta je? Sad ću ti kažem šta je.
No, do you want to work in here or do you want to go outside?
Vi imate infektivni laring.
You tell me.
Ovo imamo.
Ja i ti šta je? Dvojka, evo sad dvojka.
Okay,
2.
When you're finished with your case,
Infektivni bronhitis.
just rotate.
How many minutes do you want to give it?
I would say 7. 7 minutes.
Per case?
Yes. Trev! Slow down. Chastity!
Do you have a
Figure it out.
Sad je ovo već. I need to write it down.
Chest. Chest. Where's your group? You can sit in here, you can go outside. I got my phone up.
I'll get mine.
Ne moramo svi napolje, može neki tu.
First one always takes the longest. And then I guess I'll set up my computer.
I brought mine back up too.
Probably take us till coffee break, right?
Yep. 7 times. Yeah. More than mine. Which is great though. Alright, should I start?
Semper Gumby.
Yeah. Do you want some water for me?
I'll get some if I want it.
And I'm happy to walk around and answer if they have any questions.
Yes,
Questions?
just see how they're doing.
Sure. Give me a second to organize.
I think the one they're going to have the most trouble with is the one that's avian metapneumovirus, it's swollen head syndrome.
Okay.
And it can look just like coryza, so there may be a complicating coryza.
Okay.
You have all you need with the presentation?
I think so. Yes.
This laptop is no more need?
I think everything is saved on Corrie's. Do you need the other laptop?
No.
No. Just leave it in case.
Okay.
Yeah.
We have professor presentation here.
Whose presentation?
It's on the laptop here. I think he uploaded it.
Oh, I changed it a bit, so.
Okay. Okay.
Corrie, I also have a thumb drive if you want to use that laptop.
I do too, but.
Okay. All right.
11 o'clock is our coffee break?
Yes. So, Corrie, I'll just go walk around a bit.
If some things go wrong.
Who'll blame you?
Oh, okay. I'm used to that. That is some of your friends.
Okay.
No
Thank you so much. And what's your name?
Dushan.
Dushan.
Ili Dule.
Elidura?
Dule.
Dule. Okay.
It's simple.
Dule.
Simpler.
Okay, I have a simple mind.
Sure is a simple mind. I never listen to those. I'm more like Iron Maiden, Metallica.
We also don't have one on the Gamboro.
I have a pretty nice short PowerPoint on Gamboro if they
Okay.
want us to cover that.
Okay.
And we have technical representatives here, so that's really important because maybe they
Just
can...
back here.
Uh-huh.
This from, and maybe Dushan, I don't know. Don't turn off. It's okay. Be turn on.
It's very crowded.
Yes. Don't turn off.
Okay.
Thank you. So, Tanya, do you want to coordinate how we move from one to another? Because I was thinking that they would bring them here and pick up another one, but it's probably better if we move them.
Sure.
Should we move them in order?
Yeah, I have to go see where everyone's
Okay.
sitting though.
All right.
I'm just gonna go in a circle.
Okay.
Yeah.
I'll follow your lead then.
Because I don't think we're gonna get one and
And if you need something else, I'm something like admin support.
Okay, very good. Thank
But
you.
Originally I'm Italian now, but
Yes, okay. So you'll be a big help.
okay.
Ima još jedna.
Joj, teško, niko promenu poslednjeg.
Hladno voda, a? Hladno voda.
Jes, ove godine nije bilo fudbalske manifestacije sportske.
Nije se ništa održavalo.
Is it going okay?
Yes, we have good questions. Nije se ništa održavalo. Onda su sredstva, prošle godine koštalo.
No, jes, prošle godine je bilo.
I onda, mislim da je to bio glavni problem. Ali opet mogli smo negdje u gradu da je jeftinije to, znaš, to je sve redi.
finished?
Not yet.
Yeah, I'm sorry, I think I know you, but I can't remember your name. From where? What's the other
A onda su nas ganjali, znaš, u jednom restoranu, morali smo sam ispod skoro do kad, pa naši mogu. Išli su bili jedni, pa knjiga, smo rekli svaki ovaj govori skoro često, tamo težnice, to smo čekali tamo. but this is ali da, ali on je za genotipizaciju.
A možda se trebalo da si ugasio kad si zašao. Trebalo se ugasio.
Znaš, mi smo imali značajno dobro raspa.
Okay, let's have a robust discussion about respiratory diseases. So much expertise in this group. It'd be really great. Now remember, this is a workshop, we're all working, but also remember, it's your workshop. If you feel it's too hot, stand up, open the window. If you need a cuppa, go get it. Water, if you need to use the restroom, walk out. It's for your learning and my learning too. Yes, chicken respiratory diseases. I just want one word. How was that case discussion? Just one word. Give me one word. One word. One word. Did you like it? Is it awful? Is it too hot? Good. Good. Yeah. Okay. I'll take good. Now we're going to review those. And we're going to ask you to contribute your expertise. So, is there anyone here who wants to explain how the chicken respiratory system works? Pretty different from mammals. Do you have a diaphragm? No, if you hold chicks too tight, they can't expand their rib cage. What happens? They die. So we've got these big air sacs. And actually, the air comes in to the air sacs on inhalation and then into the lungs on exhalation. That's why it's so important to look at the air sacs, because it's where the pathogens can hit first. We all know this already? Is that a yes? No? Yes. You know, I worry when I see screensaver faces. I'm pretty sure when I see those, I know you're making a grocery list or thinking about the email you're going to send to your girlfriend.
And maybe also, Corrie, the difference of the lungs being attached, right? So they're much more restricted in their ability to expand, which is important for some other diseases as well. But it also means they can't move pathogens out, perhaps.
Oh, that's true. Yes. Okay. And how many of you have seen respiratory problems in chickens that are submitted for necropsy? Those of you who don't have your hands up, I think you didn't understand my question. Everybody! Yeah! Okay, so if you work in a diagnostic lab, you will see respiratory cases. And of course, they impair production. So that's a problem. And tell me some respiratory diseases. I want to hear some respiratory diseases. Tell me.
Bronchitis.
Infectious bronchitis.
Yes. Laryngotracheitis.
Laryngotracheitis. Okay.
Mycoplasmosis.
Mycoplasma. Huh? Pasteurellosis. Oh. You know what? I didn't put pasteurellosis in here. But that's true. But it'll affect a lot of other body systems too. What else?
E. coli.
Oh, colibacillosis. You know, no one asked to hear about colibacillosis. Why? Do you not have a problem with colibacillosis?
Just forget. Just forget.
You know everything.
You know everything about colibacillosis?
Apparently.
Oh. Okay. So, the thing about respiratory diseases is they often travel around with their friends.
Yeah.
So making a distinct diagnosis and getting rid of the problem is very difficult. And, you know, management, why? Why is management a problem? Do chickens produce ammonia in their output? Yes. Only 10 parts per million of ammonia will paralyze the cilia. Are cilia important in respiratory defense?
Absolutely.
You know, that's the big reason that smokers get more pneumonia, because smoking paralyzes the cilia. So does ammonia. So these respiratory problems are often quite complicated. So there we have a few. We talked about some of those outside. I heard you. For each of these that we go through, we're going to go through 6 diseases. We're going to talk about really the important things that we need to know as pathologists, because our role is to help the producer get rid of the disease. So we have to make an accurate diagnosis. In order to make an accurate diagnosis, we need to know the pathogenesis so we can match the lesions with the agent. I want to tell you a story. I was in a country that shall remain nameless, and they were just gearing up their chicken production, and they brought some dead chickens in. And the veterinarian in charge of the laboratory said, we tested for Newcastle, it was positive, so we have to go out and vaccinate again. And I said, what test did you run? He said, well, we did an ELISA. So they were serologically positive. So I said, well, let's open some birds. We opened them up, colibacillosis. So just getting the result from the lab, we, as pathologists, as case coordinators, we need to see the whole thing. Why were they serologically positive for Newcastle?
Vaccinate.
Because they had recurring problems with chickens dying of colibacillosis, so they keep vaccinating them because they think it's Newcastle. I know it seems simple, but you would be amazed at sometimes the lack of communication between the test result and the person who's overseeing the case, as well as the history. Okay, we're going to talk about vaccines, and we've got some good representatives here. Can you fix it? And then what do we see pathologically? Infectious laryngotracheitis. Do we have any experts in here on ILT? How about people who have seen ILT? Okay, so I would say we have pretty good. So you remember this case, this scenario? Yes. How about a morphologic diagnosis?
Fibrinous laryngitis.
Fibrinous tracheitis. Does anybody want to modify that? Fibrinous tracheitis. Are you happy with that?
Shouldn't there be bleeding?
Why would there be bleeding?
Why?
Because we are losing the layer of mucosa.
Oh, great. That's great. Why are we losing the layer of mucosa?
Necrosis.
Because
Why is it necrosis?
because the virus is replicating in there.
All right. Do viruses replicate inside cells or outside cells? Inside cells. And how do they get out of the cells, especially herpes viruses? They blow them up. Right.
Yeah.
So we actually have an ulcer. And anytime we have an ulcer, the submucosal vasculature is exposed. And when that's exposed, what's the first thing that comes out of the bloodstream to fix the problem? Fibrin. So fibrin always means there has been a severe mucosal insult or a severe insult. Now, Igor said this was fibrinous tracheitis. Anybody wanna, let's say you're talking to somebody on the phone. Yeah, they're not looking at this.
Sometimes
I
there
saw
are
fibrinous
conjunctivitis.
tracheitis. Can you- What is it?
In some cases, they have the conjunctivitis also.
Yes, they do, but
Yeah.
we're looking at the trachea here. I would call that actually a fibrin cast. Or a fibrin plug. Because there are other diseases that will give you a little layer of fibrin, but only ILT will give you that big plug, often with blood. How many have seen laryngotracheitis on the farm?
I said those.
On the farm? Radmila, did you want to say something?
I think yes, but our government said no, we haven't. I
Government knows best. You should learn it.
This is creation of the field.
Yes, all right, but if you did happen to see it, birds are coughing, high mortality, and here's a, oh, there's another fibrin plug, fibrinous pharyngitis. Is fibrin acute or chronic?
Acute.
Always acute.
Always.
Always. Okay. I think we'll go here. Yeah. So, what's the agent? Which
Herpes
herpes?
virus.
And if we're going to take the passports, you have to say what virus it is.
Herpes.
Official name of the virus? Okay, how about this?
Galin. Herpes virus 1 is...
Is there a herpes virus 2? I don't know. There is? There's a gallon herpes virus 2? What does it do? Okay. How bad is ILT?
Very bad.
This is one of the worst. We're seeing this a lot now in our backyard birds. A lot of people want to raise 5 chickens and have the eggs every day. Yeah. All right, pathogenesis. Every virus, I think of viral pathogenesis as being lock and key. So the virus has to have something on the surface that binds to a receptor, which means only cells with that type of receptor can be infected. This virus likes ciliated cells of the upper respiratory tract. Yeah. It gets in, replicates, blows them up. There you have it. So we see it in the sinuses, sometimes in the conjunctiva, but the trachea tends to be hit the worst. Okay, now, you don't have it in this country, but let's say, you know, we have similar problems in the U.S. I was working with a researcher who found a new strain of ILT, and the government didn't want her to publish her results. So this happens everywhere, and why does it happen? Because,
Economical reasons.
yes, these are commercial animals. It's worth money. Yes. So we really want to help the producer stay free of ILT. And how will we do that? Biosecurity. Yeah, good idea. But what if it breaches the biosecurity and gets in? What will you do?
Vaccinate, of course.
Do you have a vaccine?
Not Serbia yet, but we will finish recombinant.
Really?
Yes.
Okay, recombinant with what?
With Marek, with HVT.
So, HVT, which is herpes.
Yes.
HVT is herpes.
Turkey herpes.
Turkey herpes. and that protects against Marek's. I know about turkey herpes because when I was working at Plum Island, they were importing a cell culture, and I had to safety test it, and I inoculated myself. Some kind of klutz, you know? So I did a research because I wanted to make sure I wasn't going to get sick. So, what are you going to put into the turkey herpes?
As I recall, 2 glycoproteins.
2 glycoproteins. Because ILT has about 90 proteins. So you've discovered which are the important proteins for immunogenicity.
Not me.
Okay.
Experts pronounce
Okay.
yes.
Good. So there is already a vaccine. It's a modified live, isn't it?
Yes.
Uh-huh. It doesn't always protect. And what's the problem with herpes viruses in general? Let's. What is it?
They incorporate into the DNA.
Yes, they actually become latent, and the animal is basically latent, and if the bird gets stressed, it will issue those herpes virions again.
Okay, regarding this one, in laryngotracheitis, in which specifically cells does it incorporate? Is there any specific organ with the viral?
Yeah. Do we know for sure? Does anybody know for sure? I did some in situ hybridization in my lab. We were looking for it in the trigeminal ganglion. We didn't find it there, but we thought our assay wasn't sensitive enough. Does anyone know where ILT becomes latent?
We talk about the herpes virus in general.
Yes?
Ganglions.
Yes. Okay. So.
Is it the same situation with IBR or
pseudorabies?
Herpes virus, etc.
Uh-huh.
It means the neural tissue and neural cells.
So if I were going to make a bet, I would say trigeminal ganglion?
Yeah, definitely.
Okay. Can you clean it up? Yeah. You can, but you have to get rid of the recovered animals as well. Right. Okay. Should we look at some pictures? If these birds are sick, really sick, and quite a few will die. Ah, I'm sick. Yeah. And the fibrin plugs in the trachea. I don't know of any other disease that's going to cause these fibrin plugs. And you want to see what it looks like histologically?
Yeah.
How many of you do histology on avian diseases? A few? Okay. So we look forward to your discussions. So here we have, what are these? Syncytia. Okay, what viruses make syncytia? When you see syncytia, what are the viruses that you think about? I'm sorry?
Paramyxoviruses, RSV.
Okay, so paramyxoviruses? Yes. All paramyxoviruses, I think all, have a pretty prominent fusion protein that they express on a cell. So that's what helps them to fuse. Some coronaviruses have it, and some herpes. Did I miss any? I think that's it. So when I see syncytia, I think paramyxovirus, corona, herpes. The virus has to have a fusion protein. And of course we have intranuclear inclusions, which you can see here. Oh wow, look at this syncytial cell! Whoa! Okay. Yeah. So what are those inclusions?
Intranuclear.
They're intranuclear inclusions. Right. What's in them? Don't you ever wonder when you see, what's in them? Why are they pink?
Crystalline viral protein.
Viral protein in the nucleus? I'm asking you.
Yeah.
Yes. Because herpes virus is actually, they do some replication in the cytoplasm and some in the nucleus. They actually do a lot of their assembly in the nucleus, so the proteins are taken from the cytoplasm. Okay, let's face it. Can the nucleus make protein?
No.
No. So how can you get protein in the nucleus? Well, it's the herpes virus that's directing it. This is why most intranuclear inclusion bodies are basophilic, because it's just viral replication in it. Does it make sense? Maybe I ask myself why too often. But we want to be good scientists. Yes. And immunohistochemistry. Wow, nice. But you almost don't need immunohistochemistry to diagnose this disease. Ready for the next one? Boyana.
How often is that misdiagnosed for a diphtheritic pox?
Oh, good question. Yeah, because as I was walking around, somebody said, pox can do this. Who has ever seen pox do that in the trachea? Have you seen that? I've never seen that. How would it look different? Because the pox virus is going to have proliferation.
Yes.
So the ulcer would be because the proliferative cells actually got pulled off. Okay. Infectious bronchitis. We saw this. Are you ready to talk about this?
You're about to give your dissertation defense, don't worry.
Okay. Do you have infectious bronchitis in the country?
Yes.
And you acknowledge that you have it?
Yes. We know.
All right. You have a lot of it?
Mm-hmm.
What's the agent?
Coronavirus.
Coronavirus. So I had a project on infectious bronchitis, and I was doing in situ hybridization to find it in the kidney and also in the embryos about the time SARS broke out. And a pathologist from Hong Kong called me and said, I'm sending you blocks. Can you check for avian coronavirus? Yeah, blocks from humans. And I looked, it did not bind, and I thought, good thing, I might have lost my funding. Because at that time they were thinking, well, maybe SARS came from chickens. But no, SARS did not turn out to be bronchitis. How bad is bronchitis?
Very bad.
It depends. Good answer. Yeah, you can get a lot of morbidity, but it's nowhere near the mortality with ILT. Pathogenesis. Pathogenesis.
Different.
How's it different?
Depends of strain.
Targets.
Very different.
Yes. So what are the cells that it likes? It's locking.
Some goes only respiratory,
Mm-hmm.
and some goes to kidneys.
Yes.
Definitely.
Do we know why the different strains go to the different places?
Well, I know they like sialic acid as a receptor.
They like what?
Sialic acid.
So, oh, sialic acid. Okay, so it's like influenza. Sialic acid. So sialic acid on the kidney cells too?
I don't know that much.
Yeah. Well, I think of it as a promiscuous virus, which is, okay, I'll go into the bronchial cells, go on a date with the bronchial cells, replicate there, and maybe I'll go on a date with the oviduct cells, replicate there. Maybe I'll go to the kidney, get into those cells. Because although it's called infectious bronchitis virus, we see a lot of other problems with it. Yeah. In the in the airways, it's going to cause loss of cilia. Okay, is there a vaccine?
Yeah.
Okay. Are you working on a vaccine, Bojana?
No.
What vaccine do you use here in Serbia?
MF5491.
Massachusetts.
Which is that, Massachusetts?
Yes.
Massachusetts and 491 is MF3B.
Okay. So, does that vaccine match the strains you have here?
Yes, in some part yes. We have pathogen 491, and also we have QX pure strain, and we have some strains which have high homology with QX, but they are not QX.
Okay. All right. So, do you feel
Basis for our knowledge.
do you feel there's a good match?
Yes, we feel yes.
Okay.
So far.
Modified live vaccine. Can you clean it up?
No.
No. No.
Why not? Why can't you clean it up?
Because we always find pathogenic strain on PCR after several years of live vaccines. When
So
we send
the
samples.
live vaccine is not, what do you call it? What's the word?
We have also inactivated for M.
Sterile immunity, yes. So even with the vaccine, they can still replicate. This is a big problem with vaccines. There are very few vaccines for animals that actually create sterile immunity. So that means they're vaccinated, they do not show the disease, but they replicate the bad virus. It passes through their system. Pathologic features. Who's seen IB? Tell us what it looks like. What do you see in the birds? I'm going to change the title of this seminar today from workshop to Corrie Talks Shop. I'm going to be really unhappy at the end of the day.
And then she'll blame me, so you have to answer.
What do you see when you see the chickens? They suffer?
Suffocating.
Let's take a look. Okay. Yeah. The young birds, they can be pretty unhappy. They have respiratory problems because it's replicating in the ciliated cells and blowing them up. And does that make them susceptible to other secondaries?
Yes.
And didn't we say that a lot of these respiratory pathogens have friends? Now, it's a mucus kind of tracheitis, different from the fibrinous. So you have a catarrhal tracheitis, bronchitis, which will decrease their ability to inhale and exhale, and they can be coughing up some of that mucus. The kidney. Actually, I think that I took this picture in Kosovo. Yeah, we did a workshop there about 4 years ago, and I thought the birds were affected by infectious bronchitis virus. So here we have this tremendous urolithiasis here. This kidney is very enlarged. It's a girl, and it was a nephritis. Has anyone seen something like this? You see it, and do you think infectious bronchitis when you see it? Is there anything else you think about? What other problems could this be?
Lack of water.
Lack of water. Yes, but I think with lack of water, we're not likely to have this huge thing.
Yeah.
You might see these, and you would see, the
Sometimes mycotoxins.
mycotoxins. Which ones? Ochratoxin?
But not like this.
Not this bad? I've also heard that a calcium-phosphorus imbalance might cause something like this. But the pathogenesis of that eludes me. Does anybody know? Okay, we'll go on. So, they can have a bronchitis with a lot of mucus and nephrosis. This is infectious bronchitis. Now, the virus also infects the cells in the oviduct. and the uterus, which are moving the egg through. So you tend to get misshapen eggs. So as the virus infects a whole flock of layers, you can have a large group of misshapen eggs. Like this. Have you seen this? Is that a yes?
Yes.
Yes.
And now, what does it look like histologically? Who has looked at infectious bronchitis histologically? Nobody. So, okay. Nottingham. Are you Nottingham?
No, I'm not Nottingham, that's next door. I am England.
England. I think you had a big wedding on the weekend. The whole world was watching. I was in Ethiopia and all the TVs were tuned to the wedding. Yes. Okay, so you've seen this. You want to tell us about it?
Well, the bronchitis is a bit non-specific, just sort of chronic lymphocytic infiltrates.
Okay. And mucus hyperplasia. And then here are all the infected cells. I see a lymphoid infiltrate. And then in the kidney, nephrosis. So the cells have the virus has gotten into the kidney cells, blown them up, and there's an awful lot of virus in there. That's immunohistochemistry. Okay, any comments about IB? Boyana, I know you're doing your PhD on bronchitis. Anything you want to tell us?
Nothing that I don't know, I think.
I
Maybe
don't
I should
know.
learn something here.
You also get secondary infections, things like egg peritonitis, perhaps secondary to...
Oh, excellent. Yes, tell us.
So, because it affects the motility in the oviduct, it makes it susceptible to ascending infections from the environment, like E. coli, causing salmonellitis and peritonitis.
Are you saying that because it affects the cilia and the oviduct and those cells, that an infection can come in from the outside all the way up the uterus and the oviduct?
That's what we think, yes.
Wow. I have heard before about people in the olden days when they didn't keep chickens quite so confined, about people finding like maybe a button or a piece of grass or something in their egg when they cracked it. So that would be reverse peristalsis, wouldn't it? It just amazes me that it would go all the way up there.
It does.
It does.
It
Okay.
does. Specifically bacteria in all age of the PS.
Okay, and once the bacteria get to the ovary,
Yes.
then it causes an explosion of one of those big ova, and you get egg yolk peritonitis, which is really a sterile peritonitis, but it's kind of yucky.
Sometimes sterile, sometimes not.
Sometimes, oh, of course, there's
Because we
bacteria in
can
there.
have bacteria, yes.
Okay, and with this IB, the albumin could be very watery. Yeah. Anything to add?
The catch window is extremely prolonged in the catcher.
It's prolonged
Yes.
in the hatch. It takes them a long time to hatch?
Catch window, yeah. Extremely.
You mean more than 21 days?
No, I mean if you have to change your values in the catcher, for example, in 8 o'clock in the morning, you can wait and wait and wait for 6 hours more and more, and you get no chicks.
Oh, really? Okay. Good to know.
Victoria, what about the chicks that are infected early and have oviducts? Are they decreased for photosers in the future?
I don't know. I don't know. I think only the layers get infected in the oviduct, right? It wouldn't be the chicks. Because in chicks you see the bronchitis.
Yes.
Oh yeah, I'm looking at you. Yeah.
Yeah.
Chicks have the bronchitis and the older ones get the oviduct. Okay.
Or about 2 minutes till coffee.
Perfect. Yes. Because now we're going to talk about the really bad one. Mycoplasma. So, are most flocks here infected with mycoplasma? Or do you have mycoplasma-free flocks? No? No, Mario, which are you saying no to? Do you have mycoplasma-free flocks?
Yes.
Are the majority mycoplasma-free? Yes? Okay, good. Mycoplasma, which is a huge part of the chronic respiratory disease complex. And the mycoplasma, oh, yes. How does mycoplasma cause disease?
Vertical mailing.
Okay, I'm going to show you how it causes disease. I need a volunteer up here. I need 2 volunteers. Yeah, come on up here. Okay, so you are a ciliated cell. And so are you. You're also a ciliated cell. Put your hands over your head.
Do your cilia stuff.
Yeah. Now, cilia are really important for taking the crud out of the respiratory tract, even in us, right? And the cilia are beating and they're sending it to the pharynx over towards Tanya. Yeah. Okay, back. Back. So stuff lands on that mucus layer. Now, I'm a mycoplasma. Yeah, I'm going to come in here, and I live right between the cilia. Try to move your arms. Oh, no, can't. Yeah. So, that's how mycoplasma works. Thank you. And of course, so what's the agent? Mycoplasma of chickens.
Yeah.
What's the causative agent?
Synovial and Galiseptic. Synovial and
Yeah,
Galiseptic.
Corrie Brown. Yes. So that would be Mycoplasma gallinarum. And we saw how it causes disease. This is a huge precursor to colibacillosis. Yeah, and others. How bad is the disease? The problem is, mycoplasma opens the door for all his friends. Can you prevent it? The best thing is to buy mycoplasma-free birds because mycoplasma is transmitted vertically. Yeah. So, and once they have it forever. They love living between the cilia. They can last it forever. You can use tylosin or tetracycline, but it doesn't really get rid of them. So, let's take a look at it, and then we'll have our coffee. So they get a sinusitis. Oh, look at this. Cilia, mycoplasma. Yeah. And they cause, as mycoplasma do in many species, they cause tremendous lymphoid proliferation. So histologically, you can tell that mycoplasma is there even though you can't see it on the slide. Here's colibacillosis. Yep. And some more oh, look at his air sac. Wow. Oh, whoa. Lymphoid follicle. Oh, this must be mycoplasma. Okay. Do we need to take a consensus for the length of coffee break, or is it already decided, Igor?
Yeah.
3 minutes.
No, whatever you want. 50 minutes.
15 minutes. Okay. We'll resume at 11:15. We'll finish this. And then do you like the scenarios? You want to do some more scenarios before lunch?
Yeah.
We can do GI scenarios and transboundary diseases. We can do them together. I think we have 6 of those. We'll do it the same way. If you're willing to work. All right, and when you give instructions to adults, you have to do it 3 times. So, you have 15 minutes for coffee. All right, you may now take a coffee break. It will be 15 minutes.
Imate kartu ovdje i...
For the next cases, can
Znači
I number them?
pauziramo od 10
That's a good idea. Yeah. I have Sharpies.
Okay, that'd be great. It's hard to like, have you seen this case?
Ovo crveno, ne? Što je crveno, ne? Ovdje. Aj, dođi, majke, ti da ti nešto ne...